Good evening, ladies and gentlemen. Welcome to Triple N Media COVID-19 World News. I am Dr. Nik Nikam, and today we are going to look at hydroxychloroquine. Hydroxychloroquine, which is marketed under the trade name Paquinil. Facts versus fiction. Again, the name is hydroxychloroquine. Basically, we are going to look at facts versus fiction, present you all the available data, and let you make the decision as what you think would be the best option for you or one of your family members or a friend if they ever need this medication for treatment of a COVID-19 infection. A few basic things about hydroxychloroquine. It is a generic drug. It is used in the treatment of malaria. It's been used for decades. It's also been used very effectively in patients with rheumatoid arthritis and almost 1.5 million patients with lupus. Especially the rheumatoid arthritis and lupus are sort of chronic autoimmune diseases, and hydroxychloroquine has been found to be effective in helping these patients. A few more points about hydroxychloroquine as far as its side effects are concerned. It prolongs the QT interval. It prolongs the electrical activity in the heart, which can predispose to fatal irregular heart rhythms such as ventricular fibrillation or ventricular tachycardia. That's an important thing that we need to keep in mind, and we're going to present one study which had serious side effects related to the QT interval. It also has nausea, vomiting, diarrhea, and some patients may experience dizziness and headache. And patients with a history of G6PD, that is glucose 6-phosphate deficiency, they should tell their doctors that you have this condition so that your doctors can decide whether you need to be taking hydroxychloroquine, as they may have side effects. Now let's continue with this. Some medical experts have found that a combination of hydroxychloroquine and an antibiotic, azithromycin, seems to help patients with COVID-19 infection, especially if it is given during the early stages of the COVID-19 infection. So let us look at some of the studies that are already in the literature and see what we can learn from them and how we can apply them at bedside when we are dealing with a mildly, moderately, or severely ill patient with the COVID-19 infection. First, we're going to look at a study from China coming from Wuhan city. That's the Wuhan study. Then we're going to look at a French study which looked at almost more than 1,000 patients, which was just recently published in the last couple of days. There's one French study which talks about cardiac toxicity. We're going to look at that. And finally, we're going to look at experiences from rheumatologists who have been using it for patients with rheumatoid arthritis and lupus. Once we look at all these things, we're going to revisit the study from the French author and see what information we can analyze from that and how either it can be proven or disproven with available clinical existing data from New York City. All right, let us continue. Here's the Wuhan study, which was reported by Dr. Zhang. I guess that's the way you pronounce it. He talked about 62 patients, half of whom received hydroxychloroquine 200 milligrams twice daily for 5 days. Their endpoints showed that those patients who were treated with hydroxychloroquine had a shorter recovery time, which was significant. They also had significant improvement in the chest CT scans, 80% in patients who treated with hydroxychloroquine compared to 55% in patients who were not treated with hydroxychloroquine. So that is the Chinese study. Next, move on to the next study, which is a French study looking at cardiac toxicity. And I talked about cardiac toxicity already because this drug is supposed to prolong the QT interval. When the QT interval is prolonged, it predisposes the heart to irregular heart rhythm. And it becomes a more serious problem in patients with history of heart disease, heart failure, or reduced heart function. But let us not forget the very drugs that we use to control these irregular heartbeats like ventricular tachycardia or ventricular fibrillation also have similar side effects. For example, sotalol and dofetilide, which are given for patients with irregular heart rhythms, can also prolong their QT interval. So whenever we are treating patients with hydroxychloroquine, this is an important point we want to keep in mind because there are certain patients who may have a tendency to develop prolonged QT interval. But if you look at the population from the rheumatoid clinics, where thousands of people have been treated with this drug for many years, the QT prolongation has not been a real issue in those patients. Nonetheless, if we are dealing with a real sick patient, they're going to be on cardiac monitor, and I think it is worthwhile to check their QT intervals if we do decide to put these patients on a combination of hydroxychloroquine and azithromycin. Let's move on to the next study, which was done by French doctor Diderot, I guess that's how you say it, from Marseille Hospital. They used hydroxychloroquine for 10 days along with azithromycin, which is generally given for 3 days. This was a very small patient population where 26 patients received a treatment and 16 patients who did not receive treatment. They measured the clearing of the virus from the nasopharyngeal passages. This is an important point to keep in mind because, as we know, the virus spreads from person to person when people sneeze, cough, or talk. So if we can reduce the viral load coming from the oropharyngeal area, that may be beneficial in terms of reducing the extent of the spread. They had no evidence of any cardiac toxicity, but in these patients, the population age was 43. That means these patients had milder problems. It also shows that younger patients with milder symptoms can be treated with this drug safely without any major side effects. That's an important thing I want you to keep in your mind. Now let's move on to the graph which relates to the previous study which I told you. Here it shows those people who were treated without the hydroxychloroquine, the amount of positive samples in the nasopharyngeal was close to almost 90%, whereas those who were treated with a combination of hydroxychloroquine and azithromycin, which is represented in the green line here, shows there was a dramatic decrease in the amount of nasopharyngeal viral shedding by the end of 5 days. That's pretty impressive. It doesn't tell you whether you're going to find benefits in terms of reducing morbidity or mortality in the hospital, but this is the first step to show that these drugs do reduce duplication or replication of the viruses. Now, here is one of the largest studies to date done again by Dr. Diderot from Marseille Hospital in France, involving 1,061 patients. They used a combination of hydroxychloroquine along with azithromycin. They had no control group, but the entire group received this treatment. There are a lot of criticisms about this study not being a controlled randomized study, but nonetheless, let's look at what information we can gather from this study and how we can apply that at bedside when we are dealing with the patients with the COVID-19 infection. In their study, out of 1,000 patients, they had 91.7% success rate. That's amazing. Only 46 patients, that is 4.3% of the patients, needed intensive care unit. The average age here was also in the 40s. So they had only 5 deaths. That means the mortality in this particular group was 0.47, less than 0.5%. Of course, as I said, the criticisms related to this study are that it is not a randomized clinical trial. We didn't have Group A, which received the treatment, and Group B, a comparable Group B, which did not receive the treatment, and we don't have a comparison. And I'm going to come back to the point about comparison in just a minute. And again, these were younger people. They were less serious, which points to me that maybe this is the best time to start treatment on patients who present with COVID positive tests and who are having symptoms. When they are having symptoms, if we track them early and treat them early enough, we may be able to reduce their rate of infection, rate of ICU admissions, and hopefully reduce their mortality. I mean, this is something we have to confirm by randomized clinical trials. In fact, Mass General Hospital has incorporated using hydroxychloroquine in the treatment protocol at the discretion of their infectious disease specialist. And again, as I mentioned to you, there are several rheumatologists who claim they have found very small evidence of COVID-19 infection in their patient population, which accounts for maybe more than 1,000 per physician. So, keeping all these points in mind, I want to go back to the French study, which we were talking about, and taking all the criticisms from the people who have looked at it from a different angle. My point is, why not we take a comparable data of 1,000 patients from New York Patient Registry, where they have the largest collection of patients with active COVID infections in the hospital, and match them for age and risk factors and see what kind of outcomes they had in terms of ICU admissions, respirators, mortality, and then see whether the data validates the French study or whether it contradicts the French study. This is just a computer-based statistical analysis which can be accomplished in a couple of days, and I think we will have an answer. I certainly hope someone watching this video will take these words and look at the New York City Patient Registry, pull up 1,000 patients, match for age and risk factors, and see what their outcomes were and compare it to this group. So then we will have two different studies, but they sort of come together. Then we can do a meta-analysis to see how the drug works in the American population. That's what's most important. So ladies and gentlemen, there are numerous studies going on at various medical centers here in the United States, and I'm hopeful within the next 4 to 6 weeks we should have an answer as whether hydroxychloroquine and azithromycin helps patients with COVID-19 infection, especially if it is used in the early stages of the COVID-19 infection. Thank you so much for watching this presentation, and please do subscribe to our YouTube channel. And if you would like us to produce a video on anything related to any topic, and especially COVID-19 infection, please drop us a message and we will try to do the research and put the information together in a non-political, unbiased fashion. Thank you so much for your time.